Hey everyone, welcome back to class. I'm Professor Ashley, and in this video I'm going to talk to you guys about telemedicine and how COVID has become the catalyst to getting telemedicine to really expand.
Hold up, wait a minute.
So telemedicine actually dates back to the early, or I guess mid 20th century, believe it or not. Okay, it's not just about the internet. So back in the day, like around 1950s, right, they actually used radios to provide medical advice to the people who were on cargo ships and of course the Navy as well. So telemedicine has actually been far back. So they use radios, but even before that, they used telegrams to deliver, medical advice to people, and even physicians would exchange information remotely using telegrams, and also radio as well when they started using radio. So telemedicine has actually been around for a long time. It's only recently that we started to really understand it, and it's starting to become mainstream. So in the last 30 years, it's actually expanded to using telephones, okay, and of course anything that has to do with the internet, which includes emails, patient portals, Google, and of course video conferencing, which is something that we're becoming much more familiar with, especially in these times of the pandemic. Okay, so telemedicine in the last 30 years, it has actually been used, not as mainstream, but it has been used somewhat to take care of heart patients, diabetes patients, and for the most part, it has actually been considered more of a solution for people who live in rural areas, because you know how people who live in rural areas don't really have great access to medical care. Okay, typically people who live in rural areas may even have to travel, for hours just to get to the nearest hospital. Okay, or to get the medical care that they really need. Okay, and for those certain patients who have chronic illnesses and need medical care on a daily basis, but then they live very remote, it's very difficult for them to to stay healthy. So telemedicine has actually become a solution for those people, and that's how it always has been in the last 30 years. However, more recently, since the pandemic has happened, it's actually helping. It's allowing patients to be seen for more regular ambulatory care services, which includes primary care and also secondary level specialty care. Okay, typically really anything that you don't necessarily have to be there in person for. They are trying to force and really push that online or telephone type of a visit with your physician or your healthcare provider. Okay, so, and this has allowed patients who need to be seen for COVID related problems to be taken care of in the hospitals, and for other patients to stay home so that they're not necessarily exposed to the virus if they don't have to be. And it's also allowed physicians and healthcare professionals who are in the hospitals to solely focus on those patients who are in more of a critical state. So, and this is also allowing for a lot of primary care physicians or generalists to see even more patients on a daily basis, which, in the past, it's always been very difficult. It's difficult to get an appointment on time with your primary care physician. I think we all know this, because they're backed up with patients. They have so many patients that they have to see. And even when you actually do get a chance to see your physician, isn't it typically like a 5-10 minute visit? And then that's it. And then the next time you get to see your primary care physician, you always have to make an appointment like maybe 2 months in advance. Isn't that the general story, right? Well, telemedicine is actually allowing generalists to include a bit more patients in their on their daily schedule, which may or may not be a good thing. I think it's a good thing for the patients, not so much for the physician, because the physician is now the physician might get burnt out, or who knows, maybe the physician enjoys being able to see more patients at a larger volume, and telemedicine might make it a whole lot easier, so that you kind of cut out a lot of the logistics, right? So in a way, it may be really good for generalists ish. Who knows? We'll see. Telemedicine is actually very new. It's just starting to become more mainstream, so we'll see in the future, I guess. But that being said, the pandemic has become this catalyst to push telemedicine and telehealth, which is kind of, those two terms are used somewhat interchangeably. They are a little bit different, and I get into that in a whole other video. But telemedicine, telehealth, whichever word you want to use, for the most part, it's becoming mainstream thanks to the pandemic. Okay, and it's only going to get bigger. We're only going to develop more better technology for us to be able to provide medical care in a remote fashion. Okay, so this is just the very beginning of it. And it's amazing how it started with the pandemic. So right now, I mean, once the pandemic hit, roughly about 80% of all ambulatory visits in the United States is being delivered via telephone or video conferencing, so telemedicine, right? And only about maybe 20% of those ambulatory visits are being delivered in person. And these numbers are definitely expected to grow in the near future, actually. So why did it take the pandemic to get us to this point? Why wasn't telemedicine being used in the past, if we clearly had the technology to do this, right? Well, in the past, I mean, I already told you guys, telemedicine has not been adopted into mainstream healthcare in the past because no one knew how to pay for it. Money makes the world go round. You already know this. And the thing is, no one really quite knew how the reimbursement situation is going to work. Okay, so providers don't know how to bill for it, and the insurance companies, including Medicare and Medicaid as well, they don't know how they should compensate for it. Okay, should it be valued the same as an in-person visit? Is telemedicine going to be providing the same quality of healthcare as an in-person visit? Should it cost the same? Should it be like half, or what? How do you do this? How do you monetize a telemedicine visit or a telehealth visit with your healthcare provider? How? But in the past, or like before the pandemic, of course, what they were doing is, what Medicare was doing is, it was allowing for telemedicine visits if you live in a rural location. Okay, so if you live in, out in the very rural location, it's difficult for you to get to see your provider and you require medical care, Medicare was actually paying for those visits. But there were some conditions that you had to meet in order for Medicare to pay for those visits. Well, last year in March, when the pandemic first really seriously hit the United States, under Trump care, they actually issued an expansion of it. Well, it's called the expansion of telehealth waiver. Okay, so they issued this whole new waiver, which would allow patients to receive telehealth services under Medicare as usual, and it would be paid for. Okay, and they did this so that people wouldn't be exposed to the virus going into their in-person visits, and also so that, of course, more people can be taken care of, and we don't have to spread the virus. So it was supposed to help kind of either way, or from both ends. And also, in addition, once that waiver was out, of course, once Medicare does something, typically other insurance companies follow behind it. So other insurance companies started coming up with ways that they would compensate or reimburse for telehealth or telemedicine visits. And in addition to that, even health share plans and other ways to pay for healthcare and other healthcare plans and whatnot have also included telehealth, telemedicine reimbursement. What telehealth services are actually covered under Medicare? So we can only expect the future to have much, much more telemedicine and telehealth services, of course. There's no telling what we're going to come up with. I mean, with the growth of technology, medical technology, and since it's going to be reimbursed, we finally have a market for all of this. The sky's the limit, probably. So what do you guys think? Do you think that the quality of telehealth and telemedicine visits are equivalent to an in-person visit? Do you think that they should be compensated at the same rate? Let me know in the comments below. All right, class dismissed. See you guys next time.